Hello and welcome to Health Online. Today, we're diving into
Understanding ectopic pregnancy, a potentially serious complication. An ectopic pregnancy occurs when a fertilized egg implants outside the uterus, most commonly in the fallopian tube. This is a serious condition that requires prompt medical attention. In a normal pregnancy, the fertilized egg implants in the uterine lining. However, in an ectopic pregnancy, the egg cannot survive. The growing tissue can cause the fallopian tube to rupture, leading to life-threatening internal bleeding. Ectopic pregnancies are relatively uncommon, affecting about 2% of pregnancies. Early diagnosis and treatment are crucial for preventing serious complications. It's important for women of childbearing age to be aware of the signs and symptoms of ectopic pregnancy. Recognizing the symptoms and seeking immediate medical care can be life-saving. This essay will explore the causes, symptoms, diagnosis, and treatment of ectopic pregnancies. We'll also discuss prevention strategies and the outlook for future pregnancies. Common sites of ectopic implantation. The fallopian tubes, which connect the ovaries to the uterus, are the most common site for ectopic pregnancies. Within the fallopian tube, the ampulla, the widest section, is where implantation occurs most frequently. This is because the fertilized egg typically spends several days in the ampulla before moving into the uterus. While less common, ectopic pregnancies can also occur in other areas. These include the ovary, cervix, and abdominal cavity. In rare instances, an ectopic pregnancy might even implant in a cesarean scar. The location of the ectopic pregnancy can influence the symptoms experienced and the treatment approach. For instance, an ectopic pregnancy in the cervix may present with different symptoms compared to one in the fallopian tube. Recognizing the signs. Symptoms of an ectopic pregnancy. Ectopic pregnancies often present with symptoms similar to those of a normal pregnancy in the early stages. This can make it challenging to distinguish between the two. Common early signs include a missed period, breast tenderness, nausea, and fatigue. As the ectopic pregnancy progresses, more specific and often alarming symptoms may arise. These include sharp or stabbing pain in the lower abdomen or pelvis, often localized to one side. Vaginal bleeding, which may be light spotting or heavier flow, is another warning sign. If the fallopian tube ruptures, it can lead to sudden, intense pain, dizziness, fainting, and even shock. It's crucial to seek immediate medical attention if you experience any of these symptoms, especially if you suspect you might be pregnant. Causes and risk factors. Understanding the contributing elements. The exact cause of ectopic pregnancies is not always clear. However, any condition that affects the fallopian tubes, hindering the egg's journey to the uterus, can increase the risk. Damage or inflammation of the fallopian tubes, often caused by pelvic inflammatory disease, PID, is a major risk factor. Previous ectopic pregnancy significantly elevates the likelihood of another occurrence. Other factors include endometriosis, a condition where uterine-like tissue grows outside the uterus, and certain fertility treatments like IVF. Tubal ligation reversal, a procedure to restore fertility after sterilization, also carries an increased risk. Additionally, smoking, advanced maternal age over 35, and a history of multiple sexual partners can contribute to the likelihood of an ectopic pregnancy.